It was here, on this block of Newport Avenue, where a stray bullet from a gang-related drive-by shooting killed youth volunteer and community advocate Victor McClinton as he walked to a friend's car this past Christmas morning. As a man beloved by his peers and the kids he mentored, McClinton's death sparked outrage and collective community loss of an innocent victim caught in the crosshairs of one of the latest episodes of violence and tragedy in Pasadena. Coming on the heels of a number of other high-profile killings in the area, some see McClinton's death as a tipping point for change. It has forced local leaders from all over the city to call for a closer focus on the root causes of crime and what some term as epidemic of violence. The idea of violence as an epidemic and public health concern has been brought to the front by Dr. Eric Walsh, Public Health Director for the City of Pasadena. Walsh says the ways people have looked and dealt with violence have perhaps not been the most effective way of ending violence.
If we simply look at violence as a criminal problem or an individual behaviors problem, then we can pour a lot of resources into locking up people for bad behavior, but it really doesn't get to the roots of the problem. So we propose in the public health world to look at violence like we look at many contagious diseases that caused epidemics. If violence is a contagious disease, maybe we can apply the same methodologies to violence and bring down the rates of violence and literally societally cure it like we have done some other diseases.
Here in Pasadena, most would agree the current state of crime has calmed considerably since its peak in the 80s and 90s. Statistics show violent crime has decreased steadily in recent years. Many perceive a disproportionate number of violent crimes taking place in the area of northwest Pasadena compared to other parts of the city. At the Jackie Robinson Center, we spoke to Horace Wormley, Deputy Director of Human Services and Recreation for the City of Pasadena. Wormley says what's taking place in northwest Pasadena can be seen as a perfect storm of ingredients, such as poverty and high unemployment, necessary to breed violent behavior.
The northwest community obviously is where there's a large concentration of unemployment. And when you have a high percentage of unemployment that's concentrated in one general area, you have individuals who have not taken advantage of the educational system. I just think that those are contributing factors to the rise of crime.
Both Wormley and Dr. Walsh say that although cases of violence are indeed a problem in northwest Pasadena, they are not exclusive to this part of town. In his idea of violence as an epidemic, Dr. Walsh says the disease of violence can be seen in everyday situations experienced by anyone, even those who are not considered to be particularly violent.
Somebody who cuts you off on the freeway and then, you drive past them and you flip them off or you do whatever, does that one act committed by that person already kind of reveal some sort of aptitude for violence?
Well, remember, violence isn't just physical. Violence is a spiritual thing. It's a way to try and tear down someone else. The ultimate form of that is to really bodily harm them or kill them. But it begins with harmful words. When in that incident of road rage, you flip that person off, what you're being is violent. You're trying to hurt the other person. That's why you're doing it. And even if they hurt you first, and of course then it escalates because that person's hurt, they want to do what? Retaliate.
And it goes back to your point about it being contagious.
Exactly.
While at the Jackie Robinson Center, we met 16-year-old Jay, who told us he was there doing community service as part of his punishment after being caught stealing while out with some friends. Jay grew up in the Meadows neighborhood near northwest Pasadena and says he's seen many of his friends end up in juvenile hall or in jail. Jay says he's found violence to be contagious from his own personal experience.
It's just a behavior you learn. Like, if you say you're around a group of kids and one person does something violent, it's contagious. It'll go around. And then a few will look at it and be like, no, I'm not going to do that, and just, leave. That's basically it.
Jay told us he's trying very hard to be one of the few who leave when violence starts to spread. He says he hopes life will take him down a road away from the crime and violence he's gotten used to being around. Jay says he wants to go to college and be a writer when he gets older. Perhaps with Jay, Dr. Walsh's ideas about violence being an epidemic that can be cured can be realized. In Pasadena, Paulo Alejandria, CCN.